So basically we're here to talk about pregnancy and actually the pre-pregnant state as well, and pre-pregnant meaning talking about preconception and contemplation to being pregnant, and then once you are pregnant, what are the things that we do as you progress through your pregnancy, as you move on to that part of your life, to kind of benefit you and the baby, and just to optimize the goal of a healthy you and the baby as you progress. Okay. So I obviously, as a timeline to logical progression, I wanted to kind of start with thinking about pregnancy and contemplation about really becoming a mom and what that entails. So we all as women are kind of faced with this biological clock that we feel is ticking, and we have these ideas of when we need to start a family, and there is that kind of biological clock, unfortunately, that looms there for all of us. We are in developmental stages as females born with a certain large pool of reservoir of follicles, but however, as we mature and through our ages, we do lose that follicular pool reservoir and become, again, as time progresses, less and less fertile, unfortunately. So basically all that means is that, yes, there is that biological clock, to make it simple. There are some time markers in our timeline that we have to kind of consider. Anyone over 35, there can be more damage and accumulation of progression of time and oxidative damage into DNA and so forth that can accumulate and make some of those cells there in the ovarian tissue abnormal. So yeah, that's the time clock where 35 becomes something where you want to start really planning, if you have not, for starting a family. So there was the constant loss of follicles, and before that, used to be some speculations about using birth control until you're ready, in terms of actual oral birth control would preserve the follicular pool, and it's no longer really the case. So as we age, as we progress, there's no way of really preserving those follicular cells. So basically there is that critical age in about 38 or so where the quality of those follicle eggs becomes a little less up to par. So however, we ovulate on a regular cycle and we can have regular periods, which is one of the time clocks to say that, hey, we're fertile. But as we age, even though we can have regular periods, that reservoir becomes more and more prone to have abnormalities. So, things that are sad, things that are miscarriages and so forth can be a little more prevalent in that age group. So what can we do on the positive note to ensure that our fertility is at its best as we progress through time? There's just some guidelines, and all these things I'm sure you've heard before, things to be healthy about to maintain your health. If you don't smoke, if you maintain a healthy weight, obesity, poor eating habits, there is some toxicity that's legitimately attached to that can not only imbalance our endocrine system and cause ovarian dysfunction and dysregulation, but then there's diabetes and hypertension that can not only make you at higher risk for, as a pregnant woman, for progression of the pregnancy, but also can make you less fertile as time goes on. So it's all about planning early if you have that luxury, because we can't control the life that we live all the time in terms of who we meet and when we're able to start our family. So, but once you're ready to thinking about it, you want to have that discussion and really open that forum up and consider the options. But while you're doing that, it's good to see your physician to ensure that your health is at its peak and best that you can to improve your chances as you progress. So buying more time. So again, more little things, lessons to live by, to work out, to remain in good cardiovascular health. Even if you're not overweight, again, lipid profiles improve, cardiovascular health improves for your lifetime with working out. Multiple things, and bone health and brain health and everything is much better with cardiovascular working out as being the key there. And vitamins and folic acid, you'll obviously hear more about that. But vitamins for anyone in basically age of reproduction age is an important parameter. Folic acid has been linked, or the lack of folic acid has been linked to neurotube defects that can be decreased if the folic acid supplementation is constant. So in a young woman, basically need to have that woman's daily vitamin We do have fortification in the U.S. of a lot of our pastas and things like that. There's fortification that we don't even know about, but there's important things that we should take vitamins, because actually folic acid being high before you even know you're pregnant is the key to prevention of those neurotube defects. Do protect yourself, and this is just overall sexual health from a sexual standpoint, from sexually transmitted diseases. Obviously, barrier protection in safe sex to not get pelvic inflammatory diseases that can cause tubular blockage, inflammation, and other issues that can lead to infertility later on. And more things about healthy food and greens, and as mom's always right, and it's true. Fruits and vegetables have antioxidants and keep you healthy. Omega-3 fatty acids keep you cardiovascular healthy, and anything that can help you with being overall healthy can kind of mitigate some of the effects of aging, but it will not stop our biological clock, unfortunately. And alcohol, yes, alcohol is not good for you in high amounts of any type. Yes, you have that proverbial glass of red wine once in a while, but this, constant drinking is not good for fertility. Either smoking or other drugs really have been found to cause problems as well. So, what about fertility and technologies? If you're, over 35 and you haven't found a life partner and you are still on the fence about what to do, or if you're even older than that and you really want to start a family and now you realize that, hey, maybe this is kind of late, what do I do now? So, he will talk about IVF and designing babies and thinking about that. That's a stepwise process that you should consider. And a couple definitely has to go, and I believe that the first step would be to have the appropriate workup with a generalist OBGYN, so that you can deem that this is indeed a referral that needs to be made for evaluation. If that's something that needs to be done, it will. So a visit with the general OBGYN we can see, diagnose, and possibly predict treatable causes of infertility, because we can look at the infertility system as a sort of a breakdown from anywhere anatomical regions of infertility, such as tubular blockage from what we talked about, possible PID or prior infection, scar tissue. It could be from an appendicitis or something that caused inflammation in the past, abnormal uterine polyps and fibroids, or even abnormal uterine shape, such as a septum in the uterus that can possibly be resected to improve chances for proper implantation of an embryo, scar tissue from prior procedures, gynecological or not, infection that hasn't been properly treated, or male infertility, which is really easy to also determine if no problems are found with the female, and part of the workup for male infertility, such as sperm analysis. Also, hormonal imbalances can be identified. First, history, just as simple as knowing what your period cycles are and how regular your periods are, which is the easiest to do, and then to look at a little more intricate factors looking at your blood work and chemistry. So again, we just kind of went over this. Ovulation, again, one of the predictors of ovulation is regular cycles. If you have regular cycles, that's pretty likely that you're ovulating at regular intervals. Hormonal imbalances, and one of those sort of examples that you'll hear out there is PCOS, polycystic ovarian syndrome. Problems with the thyroid can manifest in abnormalities in your cycles. Pituitary problems as well. So then we talk about male infertility, so a low sperm count can decrease chances of proper fertility. And anatomic abnormalities as well, it's just fibroids, endometriosis, which endometriosis can in turn cause not only ovulatory problems with toxic environment of ovulation, but cause anatomical changes to the anatomy that cause tubular blockage, and that could be a problem. And then there's genetic abnormalities, which is another finding that can be done where we can swab the buccal area to see if there's a kind of translocation or chromosomal problem that can be seen with multiple miscarriages. So that's something not only fertility, but kind of maintaining a pregnancy. It's a little more involved. So if we're thinking about having babies and we're actually in that process and our thought process and actually actively trying, so then we say, well, okay, we're trying, we're ready to have a family, we're on the right track, and how long should we try, or what's a normal time? So a young couple with a woman with irregular cycles, less than 35, and a year is a good marker. Of fecundancy, about a year time or so would be the good marker to say that after about a year, with regular, and then we talk about intercourse and regularity of that, and there's other little factors that come into mind, but that should be a good index marker for where a woman should be getting pregnant at that time. For anyone over 35, we really say, hey, well, 6 months would be a good time for actively trying, because then there possibly can be some other things that we can help with advanced IVF or so forth if that's deemed necessary. If you're planning to postpone having a family, there's some things we can do in ovarian reserve testing, which is really just looking at ultrasound, looking at your hormones to say, hey, things look good. We don't see obvious problems, and it's just some kind of a feel-good kind of measure to see what your ovulatory or fertility health is like. Just getting a little heartbeat of the health of your overall fertility, because maybe you're not ready yet, but you want to you're just curious and you want to know, hey, am I fertile, and how can this happen for me, and how fast? But again, a lot of variables there, but this one of the things we can do is day 3 of the cycle, day 3 of the period. There could be blood work done on hormones, and we can look at ultrasounds for follicular count, which is, again, these little tiny egg follicles in the ovaries. And this is something that we can screen women for, usually at 35 or so. So now we've tried and you're pregnant, and you say, well, what now? What do I do? Well, past fertility is key, and history is always key to everything. So basically, what are some of the things that make you a high risk, or someone that you should probably seek care sooner to see your provider? Well, any young woman with a prior miscarriage, not only is there anxiety, and depending on how many miscarriages, there's various things to take into account, but that's someone that would want to come and see their practitioner a little early to make sure things are going well. A prior ectopic pregnancy, and that's a pregnancy that's implanted outside of where it should be, meaning that it's not in the uterus. It could be in the fallopian tube, rarely in the ovary or somewhere outside the uterus, but that's what ectopic really means. So if that's been your history, you've had that before, that's definitely something you'd want to kind of tell your practitioner and come in and get seen early. A history of any sexually transmitted infection or a pelvic inflammatory disease, yes, because again, we worry that there is some scarring to the genital uterine system that can cause an abnormal implantation. And vaginal bleeding with current pregnancy, so your pregnancy test is positive and you're having spotting, brown, pink, red, and you're not sure what's going on, then you want to seek care and see that everything is normal. Why? I kind of explained this already, but what we can do is check hormone levels. What's called the HCG hormone can tell us kind of the how progressive advanced the pregnancy is, and whether we can or cannot see anything on ultrasound studies. Progesterone is a pregnancy hormone that also can tell us how healthy the pregnancy is, and if there's any kind of defects in that. And then again, ultrasound is the key thing that we always look at, and it's used to confirm correct implantation. It's look to see that everything is progressing normally and it's in the right spot. And then we do other blood testing to make sure if you're having bleeding or spotting that we do check your blood type, which is important for the RH, because again, that's something that you want to look for compatibility with your type of blood and the baby's. What if I do not have any of those conditions? When should I come in? I'm pretty simple. I've never had any problems. Well, around 8 weeks or so is when it's a good time that we like to see you, because we can institute our care, get started and tell you all about the things that, and get your history about things that we can do as you progress. So that's a good time to start your new obstetrics visit. We're going to ask you a whole bunch of questions about you, your family, your spouse, other kids, all your medications, all your prior histories, and it's a good time to bring your questions and your little notepad, and because there's going to be a lot of tests and blood draws and things that we're going to ask you about, and urine samples, so it's going to be a lot of things that coming at you at once, but that's the point. We're here to kind of take you on that journey step by step.